Hello, and I am Dr. Corey King from AskDrKing.com, and today we're going to cover the 3 foods that if you are a thyroid patient, you are going to want to stay away from, stay as far away from as humanly possible. Let's start with wheat because gluten-free is everywhere, and a lot of people kind of poo-poo it to the side, and even doctors and endocrinologists tell patients, don't worry about eating gluten. It's okay. It's not going to affect you. If you're a thyroid patient, you know better. But let's discuss why for some of our newly diagnosed thyroid patients or some patients that may have a little confusion about this. So wheat, and we're going to call gluten wheat from now on. Wheat, the molecular structure is almost identical to your thyroid gland's tissue. So I want you to keep that in mind because wheat has been hybridized so many times in the United States that our body, essentially, it can't even recognize it as a food source. So when you consume wheat, your immune system over here, it goes, hey, wait a second, that's a bad guy, that's a foreign invader, just like it would do if it was a bacterium that you were coming in contact with. So your immune system goes, and it destroys that wheat. But when it destroys the wheat, the byproduct is inflammation. So when that happens in the gastrointestinal tract, we can start to get bloatiness, gassiness, diarrhea. We can get the opposite in some patients. We can see chronic constipation. If you're a Crohn's or a celiac patient, oh my gosh, it's like a gut bomb going off. And remember, if you've seen other videos or read some of my blogs, I grew up with leaky gut syndrome. I grew up with IBS. That is not fun. So you've got the wheat, you have the immune system. It goes, wait a second, that's a bad guy. Destroys it. But since the molecular structure of wheat and your thyroid are almost identical, your body is also going to mark thyroid tissue for destruction. And if you are a Hashimoto's patient, oh my gosh, that is going to just cause all these different symptoms. Brain fog, it can cause joint pains, muscle pains, the bloatiness, the GI symptoms, the energy to go down, depression, anxiety, all of that simply because of what is attacking your thyroid gland was triggered by wheat. So that's why we get patients off of gluten, or we get them on a gluten-free type eating plan, because I hate the word diet. Nobody sticks to a diet. The other food is dairy, and I lump gluten and dairy in the same category because I do a lot of food sensitivity tests on patients, especially our thyroid and our autoimmune patients, and the one thing I always find in common is that when someone has a gluten allergy, we typically see them having a dairy allergy. But let's pretend that they don't even have these allergies. Dairy in the States is similar to the wheat in the States versus Europe. There's a great book, and Dr. Stephen Gundry is an MD, wrote this book called The Plant Paradox, and he goes as far as discussing the different types of cows, the different breeds of cows in Europe versus the cows here in the United States. And these specific cows in Europe, they produce a certain type of protein in their dairy, which is why if we go to Europe, especially Italy, where we went 3 years ago and pigged out on all the food that we wanted to, we can tolerate that dairy. You come here in the States and the protein in these dairy, or the dairy from the cows that they're producing, is completely different. Now, if you can name me an animal that consumes milk after infancy, do it, right? And kind of a trick question because there aren't any animals that consume their mother's breast milk after infancy. And the only animals or humans that consume milk after infancy is us, and we're not consuming our mother's breast milk. We're consuming milk that was meant for our baby calf's neurological development. And I like to think if a calf is here, we're at least kind of up here above that neurological, as far as, above the calf's neurological development. I think we're a little smarter, a little more intelligent, and our bodies are a little different than the baby calf. So we get our patients off of dairy as well, just because, look, I work with thyroid patients, I work with autoimmune, and I can tell you that those foods are going to make these patients or your condition worse. The other one is soy, and I think the media has sold patients a bill of goods when it comes to soy, because for years they were telling patients, eat soy, it's a good substitute for dairy. Well, women, soy is an estrogen. Right? So if you start increasing your levels of estrogen, that increases the risk of things like cancer, breast cancer, for example. Also, if you get an overabundance of estrogen coming into your body, your body's going to go, okay, well, we've got a lot of this estrogen. We're not supposed to. It's going to take this estrogen and it's going to start to convert it to testosterone. And if you start converting your female hormone estrogen to testosterone, you may start to look like this a little bit. Your voice may start to change. But estrogen is protective for your heart. So if your testosterone starts going up, it puts women more at risk for cardiovascular disease. And vice versa for males. Testosterone is protective for us males, but if we get a lot of estrogen coming in, oh my gosh, it can reverse the estrogen testosterone levels, and now we can be more at risk of cardiovascular disease. Males, we don't want estrogen either. We can start to develop gynecomastia, which is basically male breast. Testicles can start to shrink. Our voices can start to change, right? All because of these hormones coming in. Women that have been on birth control, exogenous hormones, that gets clogged up into the liver, and that's a separate video, and I've talked a lot about liver utilization as far as the thyroid hormones and conversion. So exogenous estrogens coming in is going to throw off the liver, which is going to throw off thyroid hormone conversion, utilization, and then you can't get your thyroid hormone into your cells. So gluten, dairy, soy, those are the big three that we tell all of our patients to avoid. So if you would like to learn more about thyroid, more about autoimmune conditions, make sure to visit our website, AskDrKing.com. I'm always putting a ton of great recipes on our Instagram page, AskDrKing. We got a ton more videos on our YouTube channel, so make sure to like and subscribe to our channel and share those videos. And check out our Facebook page as well. I'll put all the links below in the description of the video, so that way you can learn a little bit more. And if your doctor's just not quite helping you, then contact me. I work with patients remotely all throughout the country, and we have patients throughout Europe, Thailand, and Philippines, and South Africa right now, so it's pretty cool. Alrighty, I look forward to possibly speaking with you soon, and we'll see you on the next video.